This is Juju. When she was little, she discovered that she has thalassemia. Have you ever heard about it? Thalassemia is a type of inherited anemia that can be divided into 3 subtypes: minor, intermediate, and major. Juju's thalassemia is type major, which means that it is more severe. Her treatment is based on blood transfusions every 20 days, and she will do this for life. Besides the transfusions, Juju needs to use drugs to remove the iron from her body, as repeated transfusions cause iron accumulation in some organs, such as the heart and liver, and this can be fatal. This procedure has a name: iron chelation. Nowadays, there are 2 chelating options: injectable and tablets. This year, Juju decided to participate in the international art contest Iron Warriors. It aims to make people of different ages aware of thalassemia and the importance of taking the treatment properly. Children from all around the world can participate. Very curiously, Juju asked her doctor how this idea came up. He began to explain. Juju, the treatment of thalassemia major is not as it used to be. For a very long time, only one kind of iron chelator was available. To work, it must be applied in the belly with an infusion pump between 8 hours and 12 hours per day for at least 5 days a week. Also, the product was not distributed for free to the patients. Another problem was the lack of specialized centers for the treatment of thalassemia. In Brazil, the first center to offer specialized treatment was the Integrated Center of Oncology Hematologic Research for Children, CIPOI, located at the campus of the State University of Campinas, established in 1988 in collaboration with the Boldrini Children's Center. Experts performed orientation activities for parents and patients with thalassemia. However, the tiny needles used to apply the iron chelator were still not inviting to children. That is the reason why the camps have been created. On them, doctors and a multidisciplinary team had the opportunity to live with the patients of the disease, showing that although uncomfortable, the treatment provides a healthier and happier life. Through games, competitions, and activities, doctors taught the children how to apply the infusion pump and explained thalassemia in an easy way to understand. Everybody learned and had a great time. In these camps, a calendar was created for each kid to follow up his or her iron chelation schedule. In a playful way, they drew on the calendar the days that they performed and the ones they didn't perform the treatment. Some of them drew houses, others drew hearts, and there were the ones who only chose to mark the days with some different color. However, the calendar of one of the thalassemia major patient had drawn attention. On the chelation days, she drew butterflies with closed wings, representing her lack of freedom. After all, because of the drug infusion, she could not play with her friends. In the days that she did not have to use the medication, she drew butterflies with wings wide open because she could fly and do whatever she wanted. By analyzing those drawings and talking to the children, Fernando Trichta, MD, specialist in thalassemia, wanted to reverse the negative idea of the treatment. After all, the butterflies with open wings should represent the use of the drug, since only by doing the treatment it would be possible to have a quality life. Thinking about that rejection of the treatment, Dr. Trichta began working in partnership with pharmaceutical industries in developing an oral iron chelator. This chelator was developed after many studies and became available to patients in 2000. It was a very important milestone in the treatment of thalassemia, since with this drug, patients could finally feel free during treatment, being able to play, travel, and live a quality life. Today, children and teenagers from all over the world make drawings with the themes Iron Warriors and butterflies, expressing their feelings about the treatment. In Brazil, The first Iron Warriors contest took place in 2005 and was organized by Abrasta. Every year, Brazilian artworks are chosen to illustrate the international calendar of Iron Warriors in Canada. Juju was so happy with the story that she rushed home to prepare her drawing for the contest. Contact Abrasta, check the rules, and prepare your drawing. Do you know Abrasta's work? Abrasta is the Brazilian Association of Thalassemia, which aims to fight for access to quality treatment. Its first achievement was the free supply of iron chelator. Many other achievements came, such as increasing the quality and safety in blood transfusions, and also the advance of chelation therapy. In addition to the Iron Warriors contest, Abrasta organizes many other activities. Visit the website and see the work of the association and how it can help you. www.abrasta.org.br